Hello, everyone. Thank you so much for taking the time to join us either now or asynchronously when this becomes available. And so everyone knows this call is being recorded. Thank you for joining us for The Care Revolution, the Transformation of Home Health Care in Oregon. The session is named for the film that we will be showing shortly. We have with us today a star of the film, Joy Willman, who's generously agreed to join us and provide some background to the film and the current context of home care work and organizing in Oregon. Joy is Vice President of the Home Care Council and a member of the Executive Board of SEIU Local 503. Joy has been a home care worker for 28 years. She was a member of the organizing committee that launched the campaign to create a home care workers union in Oregon. Joy lives in Portland, Oregon, and is a mother of 4, a grandmother, and a great-grandmother. We're also joined today by Bob Bussel, who, with Sonia de la Cruz, made the film that we're about to see. Since 2002, Bob has been the director of the Labor Education and Research Center at the University of Oregon, as well as a professor of history at the University of Oregon. Bob has been working with the labor movement for over 4 decades. My name is Lina Stepick. I'm a sociologist on faculty with the Labor Education and Research Center at the University of Oregon. Our focus today, as I said, is the film, The Transformation of Home Health Care in Oregon. We'll start with a brief presentation, giving some overview statistics about the state of home care in Oregon. Then Bob will briefly introduce the film. We'll show it via screen share, and Joy will then share some more details about her experience and insights, as well as what's currently happening with home care workers right now in Oregon. The link to the video is also in the discussion section for this session, and please do post questions there or here, and we'll do our best to answer them after the presentations or on the discussion forum after. So first, I will briefly share some findings from a report on the state of home care work in Oregon and the need to invest in raising wages and strengthening labor standards for home care workers. This mixed method study involved analyzing public agency data sets and conducting in-depth interviews with public and private sector, union and non-union home care workers in Oregon. We've recently also conducted interviews about the current COVID crisis with home care workers, and I'd be happy to speak more about that qualitative data more in the Q&A, but for now I'm going to focus on giving an overview of the state of home care work in Oregon from more of the quantitative side, as we'll get a rich picture of workers' experiences from the film. First, we all know that home care is a rapidly growing industry as the medical, psychological, social, financial benefits of aging in place are increasingly recognized. It's also something that I think we can keep an eye out for, given how hard care facilities have been hit by the current COVID crisis. The market is growing rapidly everywhere, in part due to what some call the silver tsunami of aging baby boomers. And it's also evolving rapidly as more companies and institutions want to get a piece of this growing market share. So this distribution that we see by type of business is also quickly changing. In Oregon specifically, we have an even higher proportion of the population who's likely to need care. However, while care is very costly, the workers doing this work are not adequately compensated. The median monthly cost to clients of home care in Oregon is nearly $5,000, while workers' median monthly wages are just $1,350. This leaves 49% of workers below 200% of the federal poverty line, which includes 19% who are completely below the federal poverty line. Only 18% of home care workers have their job transportation costs covered at all by their employers, which can be a large expense, given that many workers have to cobble together multiple clients and often have long commutes between them. As I will discuss later, these figures are more extreme for non-union home care workers. Despite the fact that home care workers are generally extremely passionate and committed to their work, these low wages, combined with often hazardous working conditions, results in an annual turnover of at least 69% for non-union home care workers in Oregon. Some overview demographics that are probably pretty familiar, or at least not too surprising. The vast majority of the workforce is women, and disproportionately women of color. There's a large amount of variation and diversity of educational backgrounds as well. In Oregon, as elsewhere, having access to collective representation through a union has made a big difference for home care workers. Union worker wages are significantly higher, turnover is lower, and access to benefits is much greater as compared to non-union home care workers. Additionally, union home care workers have a voice on the job and a process for addressing hazardous working conditions, which has become only more salient in the current crisis. Even before COVID hit, nationally, home care workers experience injury rates 2 times higher than the US labor force overall. It's one of the most hazardous occupations in the country. Additionally, 61% of women home care workers in Oregon have experienced sexual, physical, or verbal abuse in their workplace. Even before COVID, home care workers were taking significant risks to their own bodily and emotional safety. And now under COVID, they're often left without adequate PPE or totally inadequate supplies of masks and gloves, forced to try to find and pay for out of pocket for these supplies. I have other examples of how non-union employers in particular use what I call compassion exploitation to guilt workers into buying supplies and food for their clients when they themselves often face food insecurity and other hazards. Thank you. Okay, thank you everyone for your patience. I'm now going to hand it over to Bob Bussel to introduce the film we'll see.
Thanks very much, Lina. So I just want to take a very brief minute to give you an overview and a backdrop for the film that you're about to see, The Care Revolution. So the Care Revolution is grounded in the Labor Education and Research Center's long association with home care workers and SEIU Local 503, the union in Oregon that began organizing them almost 25 years ago. And in the course of our work at LERC, we got to meet quite a few home care workers who entered our program, and we were repeatedly impressed by their powerful stories, courage, compassion, and commitment. And also, as you'll see in the film, and we call it the transformation of home health care, we really do see transformational changes, not only in the lives of workers, but also in the lives of the people that they care for. And the film underscores the social benefits, the broad social benefits of both unionization and collective bargaining. As far as how this film came about, we thought it would be important to document these stories. So we got a grant back in 2014 through the American Folklife Center of the Library of Congress to record 35 interviews with home health care workers. And those are on the website of the Library of Congress. They range from half an hour to an hour and 15 minutes. One thing we have seen with home care workers, they really love to have the opportunity to talk and to talk about their work. So it was a very rich archival cache of material, but then we thought, how can we make this more broadly available? And that's when, along with SEIU 503 and the Home Care Workers Council, we came up with the idea of creating a documentary film, a short documentary. And so as Sonia Dela Cruz, the videographer whose artistry we will see on this film, constantly reminded me, we did this ass backwards. You know, usually you start off with the idea of a documentary and then you work from there. We had these 35 interviews and then had to weave them into documentary form. And I think Sonia's really done a wonderful job here. And I would just simply say that I think what the film is about for us fundamentally, one of the slogans that animated the campaign back in the 1990s for home care workers in Oregon was the phrase, invisible no more. And again, I think here by telling this historical story, talking about the ongoing efforts of workers to organize and improve their lives and the care of those that they are watching, invisible no more is just not the way that home care workers are going to be conceived. So again, with an acknowledgement to Sonia Dela Cruz's videography here, I was the executive producer of the film, which mainly means I helped raise the money and did some editorial contribution, but this is really Sonia's artistry. So with that, welcome you to watch the Care Revolution, the transformation of home health care in Oregon, and we'll be happy to try to answer any questions you have afterwards. Thank you.
When you have a person that's disabled, you can't even begin to imagine what their world is like and their reference to the world is like from their point of view and their disability.
You have to educate people on what it's like to have disability. and to have to try and sustain yourself in a world that does not want such a thing.
Nobody knew about this workforce until we started organizing, and you can't talk to anybody now that doesn't know about home care.
Every caregiver and every client is different, which makes our profession unique, because there's not going to be, I'd be willing to bet there's not going to be two clients that are going to have the same things that need to be done.
She'd stay in bed all day and let me do this. Oh, yeah. She loves it. It takes strong arms to do it. It does.
I'm not sure exactly what it means. Me being a caregiver for Becky, and the fact that she's also we're domestic partners, must be honest and sincere, because it's going to show through. One of the things that I found with working with her, when I first wake her up in the morning, my job is to get her to smile.
And he does a good job.
Mm-hmm. And then that sets the day. And she can smile a lot, laugh a lot.
Yeah.
And just in her outward appearance, people can tell that she's much, much happier with herself as well as with the relationship.
Take it slow.
She takes me to my medical doctor, my dentist.
Maybe we'll get a couple of these. Come in.
She goes shopping for me because I could not do it myself.
We have a lot of fun shopping. We have a good time.
Yes, we do. This is about 2 years. I couldn't do without her, and I wouldn't want to do without her. She's very important to me.
Home care gives you a sense of self. It lets you go home at night knowing that you've done something good for somebody else, and that if you weren't there to do the work, that they would be in a lot worse situation, whether they'd be put into a residential care of some kind, or they'd have to try and maneuver things on their own. You also need to be able to cook well and clean well. You need to be able to track blood sugars and take blood pressure. And both of the people I've taken care of had very complicated medical histories, and so you have to be able to understand and track what's important.
We do deal with a lot of things that that wear on you emotionally, wear on you physically, sometimes wear on you mentally, because of the things that we have to deal with. People with cognitive issues, people who can't take care of themselves physically, so we have to physically do things for them.
If people knew how much service you provide to the person that goes beyond just cooking for them and cleaning their house, providing emotional support, psychological support, someone who, is smart enough to know that they're an equal citizen with equal rights.
If I'm taking care of somebody who has memory issues, I'm the one who I'm the one who books the doctor's appointments, I'm the one who books the dentist appointments, I'm the one who gets them to PT, I'm the one who fills the med box, makes sure that they get their meds every day. And I know people know that we do some of that, but I don't think they know that sometimes we go in and we are the organization that makes the whole place run.
If I were to give a military analogy of what it's like to be a home care worker, I would say that we are dropped behind enemy lines without proper training, no briefing, no escape maps, few rations, and asked to perform the nearly impossible.
was a system that was set up called the Client Employed Provider Program, which was a sleight of hand where the state said, oh, we're not the employer, the client is the employer. Which I found to be really sort of a strange situation because, you know, the check came from the state.
And you'll hear this a lot, right? That who's the boss for home care workers it's a complicated kind of equation, but a big piece of that is who determines the budget and what kind of money is available for workers to come in and bargain around.
We didn't have any kind of insurance. We didn't have we didn't have workers' comp. We didn't have the taxes taken out. We didn't have any kind of training at the time. There was no orientations or anything at the time. And so consequently, we had pretty much nothing.
The state paid very poorly. It was minimum wage work. There were no benefits. I referred to it as the state sweatshop on wheels because it was really exploiting workers and they were doing terrific work in helping people stay living at home.
Oregon was the first state in the United States to get a Medicaid waiver to do community-based care, home care. And it was an experiment to begin with. And, you know, when it first started, what a great idea. People want to stay in their homes. That's where their quality of life is. But they developed the whole program on the backs of the workers.
Legislation, generally speaking, and then laws that follow are not very inspiring to read. But ORS 410 is really, we've sometimes described it as the holy grail about the way in which we think about seniors and people with disabilities, their independence, dignity, and choice. And what was embedded in that legislation was the way in which we could bring the area agencies on aging that were willing to do so, bring them up to speed by having Older Americans Act programs, Oregon Project Independence programs, and Medicaid food stamps and eligibility programs operate seamlessly together.
Now there is some personal support trainings for personal support workers through the Home Care Commission that's been brought about because of SEIU.
In 2010, with the passage of House Bill 3618, the Home Care Commission's purview was expanded, and that now includes individuals who are experiencing intellectual and developmental disabilities, and that includes the families as well, and the workers that provide that service, which are called personal support workers.
Care providing is real work and should be valued and paid in that way, I think is kind of the theme we've been building on for the last 17 years. And a piece of that is making sure that we're creating the structures that professionalize the workforce and create a career path for people who want to stay in this work.
Вот тут митинги проводят, учебу мы ходим на занятия, классы.
Union, of course, going and being invited to all these meetings, to classes they have us to go through training. It really helps. Well, first, I didn't even know how to do the tasks right. Yes, it was written, but it's much more, you understand much more when it's demonstrated or told in person.
Was so righteous because they saw how their clients suffered, and you talk to any home care worker, their primary concern is their client.
Some of our things in the beginning was bring dignity home and invisible no more, and I really, really got that because I did feel like I was invisible.
Politicians work a lot of times is if one person goes and says something needs to be changed, okay, we'll think about it. But if a sea of purple shows up and says, we really think you should fund this program, it's sort of hard to ignore, you know, the sea of purple looking at you going, yes, we think it's important.
It was an amazing campaign. We got the list, we organized. It was like organizing in the sand because the turnover rate was like 100%.
I was told they were cutting spousal pay, and I said, you mean I'm out of the game? And the union, they located us, gathered us up, organized us, and we wrote letters, we called, we showed up at the Capitol at the emergency board hearing, and the senators at the last moment backed down and restored our funding. The power to together make a difference. You know, home care workers, us. SEIU, SEIU, SEIU.
When we have a voice and we have input on the job, that we can make a difference in our consumers' lives, because nobody's in the home and sees what happens for our consumers like we do, or understand what home care workers need to do the job effectively like we do.
If it hadn't been for the union, you know, coming in and helping us through a lot of this home care, we wouldn't have never had as many members, not as many people that's doing home care, because the state kept saying, you know, we was just indentured servants.
Having a strong union is really the key for them to be able to be effective advocates for their own lives and for the lives of their clients. And I think we have some really good leaders and I think our staff is amazing at, you know, holding it all together. It's not easy.
I became a union member before home care became a union. I helped create the union. I was on that team, and a bunch of great people were on that team. And Karen Thompson was the leader of the pack. Karen really understood the importance of standing together, and she was a true leader. Always had time to take care of home care stuff, plus taking care of her husband. She ended up getting some stomach issues and found out that she had cancer. I believe it was cervical, and didn't have the home care health set up yet. And so it was too late for her, and we lost her during our second contract.
She gave up her life really for home care workers to have health insurance. And she was so proud of the work that we did together.
Here in Oregon are very excited about passing a ballot measure that created an employer for the home care workers here, which will allow them to actually sit down and collectively bargain a contract, benefits such as increased wages, but also health care benefits.
And I pledge to keep working with your leadership to bring organizing rights and benefits to our health care workers in this state.
I've always been proud to say that home care workers in Oregon are the only workforce in the nation that have a constitutional right to have a union. I think that's pretty amazing.
A home care worker before the union came along, if they hurt their back lifting a client, they were just SOL. Nobody was going to help them. They had no insurance, and workman's comp wasn't going to cover anything for them. Now, however, you know, they get the same access to workman's comp that every other worker does.
The union actually gave them a structure that they could meet each other, that they could have forums to be able to talk amongst themselves, and also to exert some political power.
By people bonding together and talking about the work that they were doing and the inherent dignity of the work and the fact that they were doing something that was beneficial for society. You could see it on the faces of the people there. You could hear it in their conversations.
And so when we meet, there are people from all across the state who felt energized about keeping a solid union and keeping the ranks of the home care worker strong enough to make a vote or decision in the Capitol about how we're going to take care of disabled people in the future and what part we take in it.
That's the work we do as a union, is workers make sure that they're there, educating their legislators about the importance of funding services.
It's given us a route to help improve our consumers' life. When we go and lobby at the Capitol, we're lobbying for more money in the budget, but it's not just for paying us, it's also for supplying their services.
When you center everything around the client, when you say everything we're doing here is to strengthen our long-term care system and to shine a light on the fact that we have an aging baby boomer population who is rolling into this, what are we going to do to prepare for that tsunami?
Some clients actually want to be involved with the union, and there are several clients who have participated in our lobbying efforts and have actually gone with us up to Salem to lobby legislators, partly making comments on their own behalf and their own funding, but also for the staff that are there with them.
I don't just advocate for me, I also advocate for my clients. And it's, getting to go up there and talk to lawmakers and say what we do is important. Yes, you need to fund it, and giving them stories. Like, one of the best stories I ever heard is a friend of mine from Reedsport took her client with her, and he was asked, "What does your home care worker mean to you?" And he said, "It means I get to keep my feet."
I think what's really the most gratifying thing is knowing that you're helping someone where they can stay in their home and not be in a nursing home.
A caregiver is an extension of that person's inabilities. If they can't walk, you walk for them. If they can't see, you see for them.
I've known him since I was a child. When I moved back here to Portland, I happened to move right down the block from him. Then he started asking me to read some letters for him that he got in the mail and stuff, and it developed into a working relationship.
I'm not happy with Croker.
You're not happy with Croker?
No.
He's a large advocate in town, and so I do a lot of his speech writing and a lot of his emails. I transport him to the meetings and then interpret for him at the meetings. And through him, I've met a lot of very interesting people that I never would have expected to meet had I not met Laddie first.
My favorite kind of people are the kind of people who care about other people, who really go out of their way to demonstrate that they care about others. And home care workers, and especially the ones that I've been involved with in the union, are that kind of person.
I've done this care myself with my mom, and you're the lifeline for this person who's trying to live out the rest of their lives as independently as they can.
Caregivers play an important role in my life. With their services and support, I am able to remain in my home and to function within the community.
In a day, you may have to rearrange everything else on your schedule or your objectives because of something that came up in the care that was important to be addressed for my son in this case. It's also a very rewarding experience because he and I had an even greater bond, and I didn't think that could happen.
Una persona con disabilidad es un ser humano, ¿no? Entonces tratarlo como ser humano nada más, y el mundo es así, estamos aquí, las personas que tienen hijos o familia con alguna disabilidad, pues invitarlos a trabajar, simplemente trabajar, darles el tiempo, pero que sea el tiempo, ¿cómo se dice? El tiempo de calidad, no de cantidad, ¿no?
You gotta have patience, you gotta care about people. That's the part. You gotta be real patient because your clients are old and they have a lot of medical problems. Some of them doesn't have family and some do have family. And when you're there, you are like one of their families because you are in their private space.
People need choice, even 98 years old. You don't push them. You ask them what they need. I always listen to them first, because no matter what they agree or not, he's a human being. We respect. We take care of him as a patient. You don't need to push them around, no matter how you think. That's respect, and then mutual agreement is very important.
That person is relying on you for the quality of their life. And I have always said there's no higher honor than serving someone else and caring for someone else, either at the beginning of their life or at the end of their life. And the way we treat our elderly is a really reflection on who we are.
You have to have compassion. You have to like people. If you can do what I do and remain totally disconnected and uninvolved with the person you're doing it with, then you will, in my opinion, you should not be doing it. You have to care for them.
My husband often says to me, "What have you given up?" And I think of how far we've come with our union. We have health care for these workers now. We have paid trainings. We have policy change. We have camaraderie. We have so many. We have community.
Union membership probably, by and large, is the best thing that's happened to the home care workers' occupation, because it gives it an identity. It gives it a specific space. You can now put it as an occupational choice.
Because of the union coming in and fighting for the hours that we deserve, I'm working 14 or 18 hours a day, and I was getting paid for 2 or 3. Mm-hmm. So they're fighting for our medical. I can go to the dentist. I mean, I can get paid for the work that I've done for 20 years.
We're united as one. You know, it takes more than just one person to get things done, to share and that passion across the community. We have a lot more disabled people out there than we do caregivers, or the appropriate caregivers, that are given that unconditional passion from their heart and really want to see something out of their care.
One of the things that was very encouraging to me is that my union, even while considering helping us, actually listened.
They've given me encouragement to be a leader where I can, I'm a voice. I'm a voice for my clients. I'm a voice for my home care workers. It's helped me grow.
So the union really just kind of brought me out and made me be able to express myself and talk about things that are really important,
As a society, we have a reason to be proud of this workforce. And so we're not going back. We're never going to be invisible again. And we're going to assert our right to be a part of a legitimate workforce.
If I'm not in SEIU purple, I wear purple.
And what does that say? I mean,
that just says that we're here and we're strong, and I'm proud.
Oh, we all show up in purple. It's like, oh my God, SEIU's in the house, and they're gonna go hide in their closet.
We are the union, the mighty, mighty union, fighting for justice.
Great, thank you so much for your patience, everyone, and for joining us to view that film. Please feel free to share reactions to the film, comments, and questions in the chat here or on the discussion board. Unfortunately, due to our error, Joy is not able to join us at the moment. Hopefully she will be later, but we will promise to relay any questions and we will share her responses on the discussion board for this session. Some of the things she was hoping to share with you all today included the fact that they're about to go into bargaining again, and she wanted to note that under the current crisis, they're going to be focusing on the fact that even though home care workers are essential workers, they're not currently being recognized as such, so the invisible no more has gained renewed significance, and they're not receiving hazard pay. They're, as I mentioned, not receiving adequate PPE. I've spoken to some home care workers who've had to apply to get any supplies, and then they have gone in and received one small baggie, which is totally inadequate for being able to do their jobs. And of course, social distancing with a lot of clients is just not possible. Let's see, they've also been working a lot on organizing private agency home care workers, who, as I mentioned, face a lot of different difficulties and challenges. So I'd like to open it up if you would like to ask a question right now in real time. We can unmute you. You can raise your hand. We'll try to call on you. But also, again, please feel free to type your question in the chat or post it to the discussion board. So thank you, Barbara. So wonderful and inspiring. Could you say a little bit about the leadership development efforts that the union made? It's impressive that these women with the heavy workloads they manage have made such strides in the union. Thanks, Barbara. Thanks for joining us. Bob, do you want to take that question?
Yeah, I think I can say something about that. And, thank you, Barbara. I would, as a fellow labor educator, certainly, welcome that question. Yeah, and Barbara and I were, colleagues at the Labor Education Research Center and encountered quite a few home care workers. I would say that I think SEIU really takes leadership development seriously. And as you know, this is a dispersed workforce. You don't have people gathering at the same workplace or around the water cooler. So they really have to be particularly intentional and thoughtful about how they conduct their worker education, leadership development training. One thing I know is they've created regional structures. There are places where home care workers can come together. So some of that camaraderie that Carol Conlon spoke about occurs through these regional meetings. And they've also aligned them with political districts, because part of their leadership development is that given the way funding works, people have to not only be active in terms of what's going on at the workplace, but they've got to be visible and active advocates for public funding. So I think part of their leadership development has been to create this awareness or whetting the idea that you have to be civically and politically engaged as well as engaged as a worker. And then there's lots of trainings that are done both around particular professional skills as far as the professionalization of the work that's very important for workers. And I think they've just done a lot of work to help people find their voice. I mean, to me, one of the things that was it makes me emotional every time I see this film, and I've seen it, quite a few times, but it's just really interesting. You heard many workers say, I wasn't that involved. I was kind of marginal. I just did my work. How they found their voice, they found their confidence. And I think that's been very intentional and conscious on the part of SEIU through these trainings to build this sense of confidence so people can go to the state capitol, they can deal with legislators in their districts, they can do many of those types of things that are so crucial to, again, their treatment, but also the treatment of the workers that they care for. So yes, I think they have a pretty extensive leadership development program, professional training, and have continued to refine it and take it very seriously.
Great, thanks, Bob. And thanks, Tim. So what kind of competition is there between union and non-union agencies? What share of the workforce is unionized now, and what potential is there for a larger share? Great question. And so the majority of the workforce is union, although the majority is what we're thinking of as public sector, so what we learned about from the film. And they work through Department of Human Services in Oregon. There is one union private agency in Oregon that recently won a contract, and their wages are still much lower, but they've made significant advances as a result. And so there is potential for a lot more union organizing activity, which I know the SEIU Local 503 has been focusing on and investing in lately. And so, but at the moment there isn't much competition because of that difference, public and private. And thanks, Johnny. So I know that sometimes care workers face a false tension between unionization and patient advocacy. Was or is this tension present in Oregon home care organizing, and how did home care workers recognize that unionization could effectively address client advocacy issues? Great question. Thank you so much. I'm sure Bob can speak to that just really briefly from some of my interviews. I mentioned a term that I actually shouldn't take any credit for, compassion exploitation, that was developed by a behavioral health worker turned AFSCME union organizer here in Portland. And we're writing a paper now about compassion exploitation in social service work, but also home care work. I think it now is expanding to a lot of different industries. And part of the organizing conversation with workers who work in service, work with clients, care deeply about their clients, is making that transformation from where employers guilt them for doing things above and beyond their job description that they're not compensated for, et cetera, to understanding that lifting up the standards for workers will actually improve client outcomes. And so we've seen that in the organizing conversations that AFSCME is having with behavioral health workers. We see it in the organizing conversations home care workers have with each other. And Bob, you could probably speak more specifically to this process for 503.
Well, I would certainly echo what you said, Lina, that I think right from the inception, you know, and SEIU is one of the larger, it may be the largest union in the state of Oregon, or certainly one of the largest. And they've always been integrally involved in the politics of the state and seen it as a critical linkage for their members to make. So as Lina said, I think part of these organizing conversations was that if we want to improve these conditions, we have to be politically and civically engaged. And, you know, clearly there are some barriers at times to getting over that as far as, you know, what it means to engage in that sort of activism. But I think that that's been one of the great success stories of the union as far as the personal changes that lead to political awareness, and the fact that there's just this inextricable link between improving the, it's sort of like the thing you see in the buzzword in education organizing, or one of the slogans is that what students' learning conditions or teachers' working conditions. So I think in a lot of quote unquote helping professions, you see this tension. And I think increasingly this notion, you know, bargaining for the common good notions, the connections that you improve the quality of the work and the service you provide by being politically active and getting the resources and funding you need to do it, is something that SEIU has really pushed. And I think, as you can see from the film, that workers have really adopted that in full bore as part of how they operate.
Great, thanks, Bob. Oh, another great question. A couple. So let's see. Amazing film highlighting the importance of home care workers. Any thoughts about other workers in the healthcare space currently that need representation and have been overlooked historically? It's a great question. Bob, do you have any thoughts?
So I'm just looking, let's see, where's, I'm just trying, is that further up in the chat?
Mm-hmm.
Wait, I'm just trying to find it.
So I'd also welcome anyone to respond in the chat as well, any participants. But I think it's something that's coming up quite a bit now, especially with COVID, especially with talks about essential workers and lifting up how low-wage healthcare workers are often overlooked and are facing some of the greatest risks right now as they had before. Bob, do you have anything to add? Oh, you're muted. Bob, you're muted.
That's something that people rarely say about me, that I'm muted. No, I think that, I think it's pretty clear that healthcare really is one of the most fertile areas for union organizing. And again, these recognitions we've been talking about, I think increasingly, you know, and we've been doing a lot of work on this here in Oregon, and I know others have elsewhere, that if you really want to make a change, not only in your life, but the quality of care that you provide, inevitably you have to turn toward the political realm. There are questions about funding, there are questions about regulation. We're seeing this during COVID, and if you really want to have some effective level of power to have a genuine voice that can make these things happen. So I think we're seeing this at all levels of healthcare, and it just seems to me one of the places where some of the most exciting things are really happening. And, we're proud in Oregon that Oregon's been kind of a pioneer in this, but I know that this is happening elsewhere. And it's difficult, it's arduous, and I think it really requires broadly based types of campaigns as well, and certainly a strong element, a community component. And when in Oregon, when this first got on the ballot, it's a ballot measure to qualify that workers could actually be organized. I think it won 64% of the vote. And that really was because SEIU right from the beginning, used a strong community campaign. So I think, healthcare is going to be a critical battleground. And I think these broadly based alliances are going to be a major part of that.
Great, thanks. And there's a great question here from Zach from Penn State. Thanks for joining us from Happy Valley. And so COVID shows the continued lack of focus on seniors and workers in all of long-term care. Anything happening in Oregon on the positive front because of COVID, led by unions or legislators in Pennsylvania, where home care union isn't as far along as Oregon. They're using COVID to win some paid training for home care workers, trying to get collective bargaining because of the crisis. Will the COVID crisis in nursing homes lead from more interest, resources towards home care rather than a nursing home setting? So that's something that we've been talking about a lot, speculating about. Unfortunately, I don't have any great data about it just yet. But we expect that to be the case. And of course, as I mentioned, the SEIU Local 503 is going into bargaining and planning to really make that case to make gains. They've already secured a letter of agreement with the public agency, DHS in Oregon, for paid time off, which was a huge issue because workers didn't necessarily have the ability to take time off to leave their employment if they felt that it was unsafe due to COVID. And now in a limited sense they do. And so they're hoping to expand that. They're hoping to expand hazard pay, et cetera. And I think SEIU 503 has also been looking more seriously into organizing in long-term care facilities as well. So we'd love to hear more about what's going on in Pennsylvania. That's super exciting. And in terms of paid training, SEIU 503 in Oregon did make a pretty significant win in the last legislative session with Bob might remember, but I think it's SB 669, which provides a paid training trust and structure requirements. Yeah. And got a, let's see, a follow-up from Tim. Let's see, so wondering about the comment that there isn't much competition between public and private, but are costs of the private agencies lower because of their lower wages and benefits? If so, are there payers such as private clients or others that are tempted to choose private agencies for that reason? That is a great question. So the funding mechanisms, if I understand correctly, and I'm definitely not an expert in that area, are very different. And so folks are able to access private agencies if they have Medicare, lots of different funding mechanisms, but they're more restricted if they're trying to access the public agency provided home care. They have to have certain qualifications. And so I do expect, actually, yeah, I think probably folks on this call have better expertise in this, but we do expect to see other institutions, hospitals, expanding more into home care, other agencies that previously just did hospice care, expanding into broader home care, trying to take a piece of this expanded market share. And so we expect to see the phenomenon of competition amongst those agencies to increase. However, the wages being lower in the private agencies, I would caution the cost to consumer is not necessarily lower. So we're at time, and I just want to thank everyone so much for taking the time to join us and for thoughtful questions. And please continue to engage on the discussion board. We will share questions with Joy and we will share her responses there. Thank you so much. Bob, you're muted. Bob, you're muted.
The film is available for free, shameless plug, but we just love to have it shown. So you can go to the Labor Education Research Center website. It's there, and it's also on Vimeo under the title The Care Revolution. So, you know, we're just anxious to have it shown in as many places as possible. So it's readily accessible. And thank you.
Great, thank you.